The following program is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.
Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Bermel, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we inform you about breakthroughs in medicine, educate you about the growing concerns medical professionals, politicians, and experts alike have about Obamacare, and highlight the work of Dr. Alfred Bonati and the Bonati Spine Institute by sharing some of our patients' remarkable recovery stories. In today's show, I'll be joined by my American Medicine Today radio co-host Ethan Euchre as we interview Dr. Randall Latore, an ear, nose, and throat doctor or otolaryngologist working with a less invasive solution for chronic sinusitis by using balloon sinus dilation. Next, we'll hear from Angelo Sapia, a man who visited Dr. Bonati in 2008 that was confined to a wheelchair and he couldn't stand for more than 15 seconds. Dr. Bonati removed screws from a previous fusion surgery Angelo had performed in Maryland that was causing his pain. 6 years later, he returned experiencing pain and difficulty breathing in a different area that once again was caused by the fusion surgery performed years earlier at another facility. We'll hear from a very grateful patient about his remarkable recovery after receiving the exclusive patented Bonati spine procedures from Dr. Alfred Bonati. In our final segment, we are proud to be joined by investigative reporter and Fox News host John Stossel during our broadcast of American Medicine Today, airing on News Radio 970 WFLA in Tampa. We will speak with him about the growing concerns that we have all about Obamacare and how it will affect all Americans. Finally, we'll be joined by Dr. Bonati to hear his comments about what needs to be done to correct this crisis in American medicine today. Joining me in our first segment is radio and program executive co-host of American Medicine Today, Ethan Euchre.
Thank you, Kimberly. Every Saturday at noon, we are joined by interesting guests who shed light on the growing concerns many Americans have about their medical care. We're also driven by Dr. Bonati's quest to find medical experts who are pushing beyond conventional methods and are finding minimally invasive treatment options.
We are proud to introduce our first guest, Dr. Randall Latore, an otolaryngologist from Florida Medical Clinic. We visited him at his office as he performed balloon sinus dilation.
With millions of people suffering from chronic sinus problems, this segment should be interesting to almost everyone in our audience who suffers or knows someone who suffers from breathing problems.
Hi, we're here with Dr. Randall Latore, and he's an otolaryngologist. Hopefully I got that right. But we just actually witnessed a surgery, a sinus balloon surgery of one of his patients. So, Dr. Latore, how many people suffer with sinus problems?
There are over 50 million patients that probably suffer from sinusitis, what we call inflammation, and or an infection or acute. Mainly, I'm treating the chronic patient, the patient that has recurrent acute infections and needs some sort of treatment and trying to avoid this trip to the surgical arena.
And Dr. Latore, there's apparently 8 different sinuses in the face and in the head. I didn't even realize that you had some so far up in the forehead. What is the purpose of some of these sinuses?
Well, the sinuses are thought to do 2 things. One is to maybe make the head not as heavy because they're actually spaces within the skull itself, so it gives us sort of a lighter weight, but it also works as far as warming and also filtering out air we breathe, which is very important, especially in dusty or pollen-filled environments like Florida.
And we saw, Kimberly, during the process of the balloon treatment, and maybe you can even show folks on the diagram there, you have a guiding light, a tracer light that you called it?
Kind of
something like that, an
Yeah.
LED light that you put up into the sinus cavity. And with the lights out, you could see it glowing through his head. It was
Right.
It was very amazing.
It's pretty impressive when you see it, but just for some basic anatomy, in the typical patient, we have 8 sinuses, but the sinuses that I can treat with the balloon dilation method are 6. And those are the frontal sinuses behind your forehead, the maxillary sinuses behind your cheekbone, and this sinus right in the center of your head, which is called the sphenoid sinus. So essentially the device has a long sort of post that I advance the balloon over, and I use that guide light, which is an LED fiber, to light up the sinus that I'm about to dilate. And literally once I enter the sinus, I advance that light wire, and you will see the glow onto the forehead or onto the cheek, really telling you I'm right in the position and I can balloon that sinus.
And so the patient that we saw today, what exactly were sort of his symptoms and issues? Why was he here? Why was he a candidate?
He's a perfect example of the patient that suffers from chronic sinusitis. And so those are the patients that suffer from constant facial pain and pressure, headaches, chronic postnasal drip, sore throat, coughing. And some of the patients oftentimes complain of dental sensitivity. So when they eat, their teeth are sore. And that's oftentimes just due to inflammation of this sinus along the floor, because the dentition, the roots, actually approach the floor of the sinus. And so they'll feel that sensitivity. And they're the patients that we want to treat because they're not infected. We don't need antibiotics. But now we need a procedure to actually open the sinus to allow two things, aeration and then ventilation.
Let me ask you something though. This procedure, is it just a once in a lifetime thing?
These procedures were, at one point, we used it as a tool in the operating room. What I've done now is taken this out of the operating room to do this in the office without general anesthesia. The patient's awake, as you saw, and it's a permanent procedure. It's not just a quick fix, and then later on we set them up for sinus surgery.
You know, you say quick fix. How long is the surgery?
This procedure itself, and I call it a procedure, and I save the word surgery commonly for the operating room, but this one takes, as you saw, it took 20, 30 minutes to do.
It's fast.
And it actually takes more time to get the patient anesthetized than to actually do the balloon procedure. And if I take that same patient to the operating room, that procedure or that surgery is going to take about 2 hours.
Dr. Latore, you mentioned that you started off in would you call it invasive nasal surgery before? Why don't you tell us how the procedure has evolved over, say, the last 20 years?
Well, when I trained, it was about 15, 16 years ago, we were doing what's called traditional sinus surgery. I don't like to use scraping because we really don't do that. We try to preserve the lining of the sinus and do as little scraping as possible. But that does entail removing bone and tissue using very fine cutting instruments in the operating room. So when you're doing that, obviously, you're going to have more bleeding, you're going to have more scarring and potential infections after that surgery. Patients do great, but the time that it takes to heal is much longer. Patients are out of work about 7 days. I will see them weekly in the office to do a sinus cleaning, so to speak, probably 4 weeks in a row. So it's very time consuming for the patient. So just like everything in medicine, things are growing leaps and bounds as far as technology, and the goal is to become as minimally invasive as possible, yet obtain the same results of traditional surgeries. And that's how this balloon dilation came about. We actually borrowed this from the cardiologists and their balloon stenting of the arteries and just took it a step further for something in the nose. And so now, without having to remove tissue, create scarring, create inflammation, and take the patient to the operating room, we can safely do it here in the office with minimal invasive maneuvers, and the healing is that much faster.
Well, it was pretty amazing to watch and to witness. Kimberly and I were pretty thrilled to get to check it out.
Great. I'm glad to have you guys. It was a great time.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility, from your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows the surgeon more access to their patients and allows you to go home the same day. We'll be right back to hear from one of our Bonati Spine procedure recipients that have seen remarkable results in our Back to Life segment.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
Hi,
I'm Angelo Sapia, and I am one of Dr. Bonati's patients. I'm very happy. I just had my 3 surgeries, and I'm back in the saddle again, and I'm ready to go back home to Pennsylvania. I flew from Pennsylvania to here, and I would go anywhere on the planet, wherever he is, to go see him. I came here to the Bonati Institute in 2008, after I had a fusion, and I was told that I would need to just go through pain management, getting shots and lysis of adhesion, and other kind of treatments that would take away the pain from my fusion. I didn't like that. I couldn't live with that. I was in a wheelchair. I couldn't stand up for more than 15 seconds. So I found out about the Bonati Institute, and I came here. And within, I think it was the first surgery he gave me, I was able to stand up on 1 foot. And the second surgery, he removed a bolt from the fusion that was against my nerve, and that gave me my left foot. And now I'm back again, now this 2014, because the other bolt was against my nerve as well, and I did not know that. So he took that out as well. And he's corrected some of the issues from the fusion that the doctor had done to me back in Maryland. I had broken my back, and when I broke my back, I went to a few different doctors, and I finally found one doctor that wanted to do a cage implant in me. And I was getting ready to do that cage in California, and I found out the guy that invented that cage was actually in Maryland. So I went to Maryland and had it done there. Well, I was going to have it done there, but the guy told me, that's a bad operation, don't do it that way, do it this way. And so I took his advice, because he was a world-renowned surgeon, and I took his advice and I had the fusion done. Unfortunately, that was a mistake. I shouldn't have done it. You should never be fused, unless your bones are broken in little pieces. Then you get bolts and nuts. Other than that, it can be fixed without hardware. It can be fixed almost painless. And you'll be awake while he does the surgery, so you'll be sure that you're still going to be walking and feeling good after the surgery. I had a problem that's been affecting me over the past 4 or 5 months, that whenever I would lean forward a little bit, I would lose my breath. It would take my breath away from a pain in my back, and I thought it was a disc or something else like that. And Dr. Bonati, when he saw the x-rays and I told him where the pain was, he said, no, that's a spinous process, and that's just a couple nerves, and we'll take care of that in 5 minutes. And I didn't believe him. I'll be blunt. I couldn't believe it. And he took me into surgery, and I barely was out. And Dr. Hirschheiser is the anesthesiologist, and I was talking with him.
Yeah, the fun thing about working here is our patients all get better. When you deal in pain management, which is my specialty here, mainly I'm in, patients a lot of times are on narcotics all their life, they're on pumps, they're on stimulators. We don't get that. Our patients, when they come here a lot of times on heavy duty drugs, and when they leave, they're off those. Or if they come here on a pain pump, by the time that they're done here, the pain pump's turned off. So, you see a patient, and I said this a million times, they have a frown on their face, a furrowed brow when they come in, and when they leave, they've totally done a personality change.
And he says, this is going to be nothing, it's a walk in the park. And it certainly was. A couple stings, it would sting, done. And I got up, and in the operating room, they got me up, pulled the tubes off of me, and made me stand and walk around inside the operating room to make sure the pain was gone.
Dr. Bonati, he asks us, did the patient move? Did you have them walk? Did you have them wiggle and twist and move in a way to reproduce their pain in the operating room? And the answer is yes, you better have, because that's the way we see if the pain is gone.
I don't know where you can find that kind of service. I just don't know. I mean, everybody else knocks you out. So this guy, and the pain was gone. And to my amazement, because I was sure he was wrong. But as usual, he's always right. The second surgery was to address the fusion, because after you have a fusion, the levels above and below it tend to break away, and you'll have the same problem again, so you'll need another fusion. And then they'll bolt that one onto the next one, and then after you have that for a few years, the next one will break away. And it's a vicious cycle until you're all fused up. If you come to the Bonati Institute, He'll fix it without hardware, and he'll fix it without fusion, and you won't be breaking away ever again. All your bones will stay intact for the rest of your life. And that's what he does. To get the surgery, everybody's talking to you, everybody's happy. And I guess it's easy to be happy here when you see so many people come in so sad. I mean, their life is over for a lot of them, they feel, and they can end up coming in a wheelchair like I did and walk out. That's big. I don't know how else you can say that, but that's amazing. It was for me, it was for my wife, it was for my daughter. Everybody couldn't believe it. Well, now that I'm pain free, I could go back to my work. I'm going to need a little bit of rest time, maybe 6 weeks or so. But after that, I'm going to go back and do exactly what I did, maybe even some more than what I did, because I've had my back problems for a while, and I was limited on what I could do and what I couldn't do. And now, I don't really have any limitations at all. So the sky's the limit here. I tell my friends all the time, same thing. They can't believe it. And they can't believe the pieces of metal that they pulled out of me that were mostly the problem. Every time I come here, I feel heartfelt. And I almost break down and cry when I'm going to talk about it, because this man is a genius beyond his years. He's ahead of his time.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done, and we can correct that.
And all the other institutes that seem to do back surgery seem to have been trained here under his tutelage. So I would rather go to the teacher than the student myself. He's brought me back my life, my career. The people here are outstanding. You will find no people like this anywhere on the planet. I've been to 20 other doctors, and never once did I get the kind of satisfaction that I get here. If you have a back problem and you don't go to Bonati, you made a mistake.
This is the first time that I am pain-free after 18 years, and it's just wonderful. I love it.
Phenomenal results, no pain whatsoever.
My pain is virtually gone, nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome has been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
When I first met him, and he reviewed the MRI, and was, while reviewing the MRI, was saying, you have a problem here that gives you pain. It should have pain here. And it's like, well, exactly. Well, I've had a lot of people ask me about my back, and when I explained to them that I'm virtually pain-free, I have recommended, since my surgery, 3 people to Dr. Bonati. And my comment to them was, it worked for me. You need at least a consult. Get an MRI, get a consult, and then you make your decision from there. So anyone that had pain like me, I definitely recommend the Bonati Spine Institute.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
In our final segment, we'll be joined by investigative reporter and Fox News host John Stossel during our broadcast of American Medicine Today, airing on News Radio 970 WFLA in Tampa.
You know, Ethan, it's really interesting to see Dr. Bonati's concerns and views on Obamacare are echoed by our next guest. In highlighting this crisis, we like to reach out to other experts, politicians, and reporters that have their fingers on the pulse of America to show everyone why it is we need to pay more attention to what's happening in American medicine today.
Good afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Brummel, joined by Ethan Euchre and world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute. Well, we're excited because we have John Stossel, investigative journalist and libertarian columnist and host of Stossel on Fox Business, joining us on the phone. So we're big fans of your show, John, and
you have such good judgment.
I would say so. We've been fans of you from many moons ago. We want to ask, what is your take on Obamacare, the supposed Affordable Health Care Act, and then we'd like to also touch on the ongoing veteran scandal.
My take is what I learned from 25 years of consumer reporting is that the market works better than anything else, imperfect as it is, and we don't have it in medicine. Republicans often say, well, they're killing the free market in medicine, but we haven't had that since we gave special tax preference to company insurance policies. So the only way a market really works is when the individual deals directly with the provider.
Right.
So you want spine surgery, you go to the doctor, and the doctor says it's going to cost you this, or you're poor, I'll make you this deal in chickens. Whatever it is, it needs to be one-on-one, where then the patient shops around and decides, do I really want this procedure or not? And you can say, well, they don't have enough information to know if they need spine surgery or heart treatment. It's not a market. But it is. Everything can be a market. You just need a few people who are passionate and study it or are experts. And through word of mouth, the good news and the bad news spread, and everybody improves. You look at the one area in medicine where you got a free market, or two, really, plastic surgery and LASIK eye surgery, procedures where the patient pays himself. And what's happened? The prices have come down, and the quality has gone up. The doctors give out their cell phone numbers to patients because they have to compete for patients and keep them happy.
Right.
But Obamacare makes this sort of other people deciding for you destruction of the individual choice that makes a market work. Obamacare accelerates that.
What are your thoughts on the constitutionality of it, John? Because that seems to come up again and again. Is this something that the president should have the authority to make people purchase health care?
No, but the Constitution is not my specialty.
Right.
Okay, nor is it President Obama's, I do believe.
And I do wish that people would get the difference between rights. You have a right for this. Well, you have a right to be left alone. And the Constitution is filled with that. The right to free speech means you have the right not to have someone order you to shut up or to order you not to practice your religion. But to say you have a right to health care means that you have a right to take stuff from other people, to force other people to give you money to pay a doctor or to force a doctor to treat you. That's very different.
I really think that the major trouble that we have is that physicians themselves are irresponsible to the patient care and medicine. They corner themselves. They talk a lot in the operating rooms or in some type of meetings that they have, but they never go and say, we are not going to accept this. One of the problems is that you see that right now they have a TRICARE that is a type of a service that they give to the vets that they can go to see physicians outside, and they block constantly. It's a sabotage at veterans that they seek civilian care. then they don't pay the doctors. So American Medical Association talks about representing physicians. That's a joke. American Medical Association is a crappy type of an association of 16,000 individuals that they serve, that they are associated with. Is a political thing, and more than anything, they serve practically insurance. So the next thing that happens is representing doctors. That is something that we need to reorganize, and we need to create a system where the physicians are going to organize and going to say, we will serve the patients and we will take the responsibility of the system. What do you think about that, John?
You raised several points. I don't agree with your last point. We have to organize. You can't organize. People have tried to find ways to organize to make things better forever. Mm-hmm. That's what communism was. Mm-hmm. If you have a market, then the doctor and the patient quickly figure out what works best for them. Everybody makes changes to solve it every 2 seconds. If you have an organization, then nobody makes changes because you got to follow the rule book. You make changes every 4 years when there's an election. The AMA is no worse than every other trade association. The kind of people who like to run for election and then meet, have long meetings in windowless rooms, are the kind of people who join the Dental Association and the Farm Association. They're the bureaucrats. They become leftists. AARP is supposed to represent old people. Mm-hmm. It's become a socialist organization wanting to suck more money out of the government.
We certainly appreciate your time, John Stossel, investigative journalist and libertarian columnist and host of Stossel on Fox Business.
I'm sure Doc could talk to John all day
forever.
long, but we're out of time. Any parting words, Doc?
Yeah, but I like to end saying thank you for your participation with us, and I'd like to get in touch with you. You are so brilliant. We need to have people like you to help us to come up from this mess.
Amen.
Well, thank you very much.
You are listening to American Medicine Today on News Radio 970 WFLA. If you or someone you know is suffering in pain, reach out to the Bonati Spine Institute, 855-267-0483 or Bonati.com. Thank you for watching American Medicine Today. If you have any comments or questions, please feel free to contact us at the number below. Or you can tweet at Dr. Bonati or hashtag American Medicine Today. When you do call, please leave your name and your phone number. We respect your views and opinions and would like to hear from you.
Thank you for watching American Medicine Today, presented by the Bonati Spine Institute. Please look in your local listings for our next regularly scheduled program. To hear more from Dr. Alfred Bonati and American Medicine Today, tune into News Radio 970 WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
Is a paid presentation for American Medicine Today and the Bonati Spine Institute. The information and opinions expressed are solely those of American Medicine Today and are not the opinions of the station, its affiliates, management, or employees.